very happy today to launch or to present formally for the first time the Douglas Data and Digital Science for Mental Health Initiative, which is called D3SM. And what we'll have today, as you will see, are several presentations to really convey what this D3SM is about. Yeah. All right. Yeah. Sorry. Okay. I hope so. Yeah. Okay. Yeah. No. Okay. So this is an initiative that has been funded by Healthy Brain for Healthy Life, so HBHL. And this initiative is coordinated, or the co-directors are Malar Chakrabarti, who could not be here today, and myself. And we have Vanessa Vadiket, who is our coordinator for this initiative. And Vanessa will be presenting shortly about this. And of course, this HBHL application was not only the work of Malar and myself, but several researchers were involved from the Douglas, from McGill, and from the outside community, notably from Western University. And the goal really is to transform research and care in mental health through digital innovation. So, and what we want to do today is a bit present what is our vision for this and how we can make that possible. So what we have developed as an overall vision or a plan, if you will, for D3SM is really to have the convergence of 4 different types of approaches or type of research, if you will. So as part of that, we have digital mental health, which include things like measurement, how to develop, let's say, digitally based measurement in different clinics here. We want to work on intervention and making, let's say, through technology, make different kinds of intervention more accessible per se. And also we're interested in how we can implement such innovation, whether measurement-based care or intervention, into standard clinical practice. Yeah, so that's for digital mental health. Data science is another, I would say, converging approaches where we want to make data that already exists, whether they are research data set or clinical administrative data that have been, let's say, collected by the Douglas Institute or by the CIUS, and make those data accessible, like more easily discoverable too, easily accessible, and make sure that that these data are managed well. And then what we've been doing also for some time, and this is under the leadership of Malar, is really to develop a strong Douglas neuroinformatics platform, which is really to create the backbone or the infrastructure, basically, to be able to capture data and to store such data, and to do also data curation. And finally, the 4th complementary approach is open science, and how we can basically make all those activities let's say, followed, let's say, open research principle or the FAIR principle. And this is from the development of projects to data collection or access to data, access to processing pipelines, and also access to, let's say, publications too. So why we're putting these 4 things together, there are several, I would say, reason or explanation for that. But really the idea was really to create a critical mass of researcher, highly qualified personnel and students who are working in these different areas, and really create a space and a place really for them to meet and exchange. And this is why. So instead of having small groups working in isolation, we really wanted to have this such a convergence of different teams working together and be able to exchange. So I will invite now maybe Vanessa to tell you a bit more about the justifications for developing the D3SM.
Pretty tall. So yeah, so why the D3SM? So since COVID, actually, the adoption of technology has grown exponentially, resulting in a crucial need for to ensure traceable, measurable, effective, and reliable care at all levels in patient trajectory throughout the healthcare system. and especially mental health. So the organizational and structural changes in the health care system in Quebec, coupled with unique ethical and logistical consideration related to psychiatric population, have posed serious challenges in modernization of mental health care. So why we want digital innovation is that there's a need for novel methods and technologies, but not only a need for the methods, for the methods and technologies, but actually for the change of, to develop a structure as well to implement these within our framework. And why at the Douglas? So throughout its history, the Douglas Institute has frequently been an early adopter of innovations approaches to patient care. The Douglas is also has a supra-regional mandate to provide mental health services to a large and varied territory. And the Douglas has made significant investments as well in digital technologies with momentum in terms of measurement-based care, for example, data management, digital approaches to interventions in mental health. So we want to make the Douglas Institute a model of digital mental health that fully integrates technology into daily clinical activities. So what do we want to accomplish? So we want to leverage actually cutting edge digital technologies, services, and to improve actually mental health care. So that could mean storing, recording, and optimizing clinical data throughout the patient trajectory, optimizing treatment based on these data as well. So through measurement-based care, improving access to these tools. So all of this is to ensure that every patient beginning their mental health care journey, no matter their entry point, will have access to the highest level of evidence-based care and services tailored to their needs. So that's pretty much like context for the D3SM. So each team will present a couple of projects that they have and they're working on. Just as a note, for a matter of time today, we won't be able to present every project within the D3SM. So the D3SM, the digital mental health team actually represents a large portfolio of projects. If you want to learn more about these projects, we have all the links and the details within our website, and you can contact the researchers listed below, I mean. So we have a couple of projects, so just to mention, so RC2S, for example, which is a cognitive remediation for social cognition in schizophrenia. There is a dialogue that is a patient self-assessment questionnaire, which enables patient-centered care. We have eNOL as well, that is measurement-based care platform. Horizons, that is an online therapeutic intervention platform. There's Sparks as well, Sparks project, which it's a game-based mental health intervention program. So I will let Caroline and Anna next to present more in detail a couple of their projects.
Donc moi, je vais présenter en français. Comme conséquence un peu directe des objectifs qui ont été présentés par Martin juste avant, on va avoir notre équipe qui va se concentrer sur 3 thèmes. Ça va être l'évaluation neurocognitive, les interventions psychologiques et les formations en ligne. Ces 3 thèmes, il faut savoir qu'ils sont vraiment étroitement intégrés au concept de implementation science et notre équipe, elle a vraiment concentré ses efforts en recherche numérique autour de ces 3 thèmes. Alors, au niveau des projets qu'on va vous présenter aujourd'hui, il y a l'étude de ICOG-CA, il va y avoir la plateforme de formation ICOG, et on va vous présenter aussi le Douglas VR, notamment le projet de VR CBT.
I'll go back to English. So ICOG is a national effort to implement online psychological interventions across Canada. So this is a project that started this year, and it's already in its 2nd cohort, and it involves 5 sites across Canada. So here at the Douglas with Dr. Lepage and We have Dr. Best at Toronto. We have Dr. Bondar and Guimond in Ottawa, Dr. Bowie in Kingston, and Dr. Menon and Woodward in Vancouver. And the idea really is that we want to promote and improve cognitive health in people with psychosis. And the way we're doing that is delivering and assessing two interventions, metacognitive training and cognitive remediation, which already have very strong evidence of effectiveness in person, but not yet in the virtual format. So our first aim of the study is to determine the clinical effectiveness of those two interventions online when delivered remotely, and also to evaluate our implementation strategy for those interventions, but also the online training platform, ECOG, that we created to train clinicians to deliver those interventions, and which Caroline is going to talk a bit more about in a second. But as I said, the project started this year. It's going to its second cohort in most of the sites. And the goal is to reach about 390 individuals with schizophrenic psychosis. And we are very intentfully evaluating, as I said, our implementation strategy for this project to make sure that it's going to be feasible in the clinical setting that we are trying to reach, but also effective. And the strategy that I'm mentioning includes not only the direct training of those clinicians using the ECOG, but also weekly supervision, plus consultation on site with the specialists that are involved in the project and have vast experience delivering and assessing those two interventions. The treatment fidelity checklist, and also the review of about 15 of the sessions that are delivered. So it's really a vast net to capture how the implementation actually is happening in those sites. All right, I'll pass to Caroline so she can talk a bit more about the platform.
Oui, donc la plateforme ECOG. ECOG, ça va être une plateforme de formation qui est destinée à faciliter les interventions cognitives, comme par exemple ABCR, donc Action-Based Cognitive Remediation Training, ou MCT, Metacognitive Training. C'est une plateforme qui va être disponible pour les professionnels de la santé qui vont réaliser des interventions à distance et qui font partie de l'essai de ICOG-CA, donc de ICOG-CA Implementation Trial. Donc, ça va être une plateforme qui est basée sur les meilleures pratiques et surtout les dernières recherches en matière d'apprentissage à distance. On a inclus des éléments de gamification, on a inclus des vidéos, on a inclus des quiz. C'est pas mal ça. Et je voulais aussi aujourd'hui parler un peu des impacts qu'on attend que la plateforme va avoir. Donc, on espère que la plateforme, elle va améliorer l'équité en matière de santé, et on va espérer aussi que la plateforme va améliorer l'accessibilité à des formations de haute qualité en evidence-based training, et que dans l'ensemble, ça va tout simplement améliorer les soins liés aux patients. Donc, ça, on a inclus des captures d'écran de la plateforme, donc qui a été réalisée. La plateforme, elle est en ligne depuis cette année, en mars 2023. Donc, il y a pas mal de contenu interactif. On va pouvoir trouver des quiz, on va pouvoir trouver des vidéos, des slides interactifs avec lesquels on peut interagir. Et on a aussi des éléments, donc plus de la gamification avec ce qu'on appelle un workflow, où les gens vont pouvoir répondre à une question et voir la réponse des autres personnes. C'est un peu le schéma qui est en bas au milieu.
All right, another project that we want to talk about today that's very exciting is the Douglas Virtual Reality Suite. So this is a project that's really in its initial stages of development. It's really just a bit more than an idea right now, but the goal is to support virtual reality applications in research and mental health care at the Douglas. And this project came from a need to have more expertise, but also more technology to give the opportunity at the Douglas for those projects to come to life, to really benefit increase the healthcare at the hospital. And we have a few partners so far. Those are working with projects that we have in lab right now. So for example, Silico Labs in virtual and Super Sublime. They're all supporting projects that are ongoing at the moment. And we are also, Caroline, Vanessa, and I, looking for other collaborators and other people doing research with VR from which we can learn, from which we can gather experience and really make this happen at the Douglas as well. And as an example of a VR project that's ongoing at our lab, I'll let Caroline talk a bit about the VR CBT.
Donc, on a une étudiante ici au doctorat qui s'appelle Quinta Seon et qui travaille sur la thérapie cognitivo-comportementale assistée par réalité virtuelle pour et avec les Inuits du Québec. Donc, je voulais tout d'abord bien mentionner que ce projet il s'inscrit dans l'idée de pouvoir améliorer les soins, l'accessibilité surtout aux soins pour les populations inuites du Québec. Et qu'on avait aussi voulu créer un environnement qui serait culturellement adapté, c'est-à-dire un environnement qui allait favoriser le bien-être physique, psychologique, social, émotionnel d'un individu. Donc, on a essayé de combiner tout ce qui allait être adaptation culturelle avec réalité virtuelle pour créer un outil qui sera à la fois bien adapté culturellement et aussi qui pourrait être efficace qui pourrait être efficace comme thérapie. Qui pourrait être complémentaire à une thérapie et qui pourrait être efficace en clinique. Donc, en plus de ça, en raison de un peu tous les syndromes de PTSD, les traumas dont sont victimes les populations inuites, on a pensé que cet outil-là, ça serait bien d'améliorer la régulation des émotions de ces populations-là. Et on a intégré aussi des mesures psychophysiologiques, de la rétroaction biologique, c'est-à-dire du biofeedback, tout ça dans l'environnement de réalité virtuelle et en essayant de fournir une thérapie cognitivo-comportementale qui serait guidée. Alors, j'ai une petite vidéo de l'environnement qui va se trouver ici. Donc voilà, ça c'est l'environnement de réalité virtuelle qui s'appelle le Practice Place. Donc, il y a un environnement assez apaisant, qui va être familier et dans lequel il va tout simplement y avoir une simulation d'une thérapie cognitivo-comportementale avec le groupe qui est ici.
So here's our contact if you have any questions that you don't have a chance to ask today. And also if you want to know a bit more about those projects that we talked today or other projects that are going on. Thank you.
Okay, so hi everyone. So I represent the data science team with Katya, Sokolov, and Massimiliano. Do you hear me? Yeah, okay. So data science team, as the name say, we trying to leverage data and leverage knowledge from the data. And the data we're gonna use in our team for now is the data that exists in our hospital. And the good news is that the data exists and already used by Perfocentre. And our goal is to build like a building block, the building block of a learning health system, which is data valorization. So mainly what we do, we work with the Perfocentre since they have access to this data. The thing is the Perfocentre, who is a part of the CIUS, they use this data for business intelligence mostly. And like if you are an administration or a politician or someone on the CIUS administration, you wanted to see how is doing a hospital, how is it doing well or not. And so mostly the domain of the existence of the Perfocentre. So we're working in collaboration with them to use this data for research in parallel what they are using for. So so the model we are trying to implement with the Perfocentre, as you can see here, it's a bit small here, but I'm gonna zoom in. So we are working mostly on the data discoverability, what the Perfocentre have as data. So we conducted a couple of interviews and we found out that this is the main bottleneck. Researcher that doesn't know what's in the Perfocentre in order to build project and research project. So we tackled the first problem, and mainly what we are trying to do is to do the data extraction from the Perfocentre. We are not doing the data extraction, but the Perfocentre work with us to extract the data that the researcher needed the most. So we are working with them to present them with what are the variable used, what are the theme that most interest the researcher, in order for them to extract these data and put it in a format that would be more discoverable. So this is the first step we're doing with them. Also, another step would be the discoverability, how researcher would go in a platform and discover this data. So we're working on discoverability, and also the last phase would be presenting this data to research. So the researcher would come out after discovering the data, he will be able, or she will be able to come up with a project and going to the ethical approval and ask for the data. So this is a collaboration with the Perfocentre. So this is for the access. Another project we leverage in our team is developing predictive model of clinical event. So we are working with the team from Sius, Gilbert, and Tremblay, and Amin Sadi to develop a predictive, like a dashboard for clinical event. This collaboration is still ongoing on project on development. We will work first with synthetic data because we cannot handle data that's sensitive. So for now, we're going to work with synthetic data on this project. And let's say the final aim of leveraging project is to build a couple of projects that uses our data, and to have a project listing for researcher who can embark in this project, and also if they are interested in subject can validate and ask for this data, like the real data, and instead of so the benefit is, as a researcher, you will see a listing of project that you know that the data is clean, that we already did some pre-processing of the data, even if it's synthetic, but synthetic would be quite equivalent to the real data, but it's synthetic. So it's less risky for the researchers to embark on project on that. Yeah, so that's mainly our big focus on the data science team.
Afternoon, everybody. I'm Gabriel Devaney from the Douglas Neuroinformatics platform. So we're kind of the leg of the D3SM overarching system, which is providing the hardware and software technical support underlying all of these other projects. So we're trying to build out infrastructure to support these various features. We have a technical team here with some data specialists, some developers, sysadmin, and we're supporting the existing infrastructure. So what does that mean? Well, first of all, our goal is to provide computing infrastructure for data which can't leave the Douglas. So there's a lot of instances where there's data collection happening inside the Douglas, which for various health reasons, for ethics reasons, for data security reasons, can't leave. So you can't go up to Compute Canada and do your processing and so on. So we're providing an infrastructure underlying the Douglas that can allow us to do that. And that's a big goal here, to be able to provide those underlying software and hardware services. Another is to provide expert technical advice for scientific processing, for software, and for development. So there's a lot of research labs, there's a lot of clinicians and so on who want to use computing, but who don't have a team member existing in their lab who can actually provide the kind of deep support of some server, some installation and maintenance of some software platform and so on, or doesn't know which is appropriate to use given a set of goals. And so we're going to be around to help them make those decisions, possibly supply those solutions for them, or point them in the direction where it would be the most appropriate for doing, for actually going on and doing the research project. And then finally, the last part of our goals is to build tools to fill those gaps where people are asking for things and an external project doesn't exist, or an existing open source project doesn't exist that will meet that need. And so that means consulting with researchers, with clinicians, with clinician researchers on requirements for their projects and building something that will meet their needs. And we're talking about the broad needs of the Douglas. And so we're already building some projects that cover some kind of broad needs, but also narrow needs when somebody needs something specific, provided that we can come to an agreement with in terms of how we'll be participating in the project and the compensation and so on. So we have infrastructure. This infrastructure is already up and running and supporting a number of research labs within the Douglas. If this rolled out from underneath the CIC, the imaging center, because it already had infrastructure. So we have storage, multiple petabytes of storage already available at the Douglas. We have compute, we have workstations. So we have compute in terms of a number of cluster machines, a Slurm cluster that can puts it all together, software that's centrally maintained so that the same versions are available everywhere, expert installation for software that's needed that you don't have. Workstation management, so we have 40 to 50 workstations already supporting multiple laboratories, all hooked up to this infrastructure. That is the machine, a new machine install and getting ready to go in about an hour if you buy a brand new computer. We help people to appropriately spec those computers so that they will meet their needs in terms of the research lab. And then cloud services. So this is something we expanded into recently. So you want to have a place for your lab to do online collaboration. You know, Slack costs money, but you're already using DNP. It turns out we have a cloud Mattermost instance, which is an open source variant of Slack. And other things like that. Email list is getting set up so that we can do, you know, if you have a limitation of you can't use MailChimp or whatever it happens to be, we're implementing that kind of feature. So we're looking to see what other cloud features can happen. So that's for when you have a computer outside the Douglas to meet some of your needs, not for obviously for data things, but rather just for collaboration and otherwise doing web-based services. So that's that. Then we have a couple of projects. So these are things that we are building and implementing within the Douglas on top of the existing infrastructure we have in order to supply specific services. We have a data capture platform. We'll get into the details a little bit more, but this is approximately a customized and specific clone of REDCap, where we're having supported versions inside the Douglas where we have a team that's building out the features that people want, instead of having to say, well, here's access to REDCap and you have to build your entire data capture system yourself. So we're trying to do a support on that thing, but also at the same time that allows us to have uniform collection, standardization, and so on. Data bank platform, naming to be figured out, but when you want to go and share your data that you've collected for some research study outside the Douglas, there are specific restrictions that are often placed based on the Research Ethics Board, and we could not find an existing software platform or data sharing platform that met those needs. So we're building it ourselves, and that's going very well. There's already a data bank that's being prepared right now to be shared in this infrastructure. And then finally have NeuroBagel, which is also in collaboration with the team at the MNI, which is for discoverability of metadata for data sets within the Douglas or within hospitals. So that's the idea of being able to say, I'm looking for a cohort of a certain property of patients between this age and that age with these things. And you can see, for example, oh, there's actually a collaborator inside the Douglas or somewhere else in the world that has data. You can't get access to the data immediately, but you now can see this data exists. You can go and contact somebody in order to, you know, work out the data sharing agreement and so on that will work for such a platform. So data capture, open data capture platform. We've got a demo already running in the cloud. Eventually, our 1.0 deployment will end up happening inside the Douglas. This is for continuous data capture, for primarily designed for clinician researchers. So anything you can think of where you're taking data inside the clinic, where MMSC, CDR, demographic information, anything that could be potentially measurable, we should collect this so that you can then potentially monitor the properties of your patient population or do predictive modeling for the data that you're already collecting. So we already have a couple of, you know, example data sets, our happiness questionnaire and some actual, you know, MMSC and the Montreal Cognitive Assessment that you can do directly live on that and put in for your subjects. Has visualization tools for looking up a specific subject and seeing what their state is versus reference populations or versus the existing population that exists in the data set. This is obviously simulated data because we don't have real data in the platform yet. Then we have the data bank, which is again building on the same kind of modern web infrastructure where we can have public data sets with sharing on a per variable basis. So somebody can apply to be accessed for, you know, variable 5, 7, and 9 in some big data set that might have hundreds to do their research project. And we have an audit logging and so on This is obviously example with the standard iris data set that comes inside R. You can see a number of features on that. And we can also see here the audit log of what's been done on that data set, which is very important for data tracking. So what else do we have besides the infrastructure and the projects we're working on? Finally, we have consulting. So you have your, if you're going to buy computer hardware for specific applications, if you have something that needs support for some measurement system, if you have some big data problem that you don't have somebody in your team who can go from writing a simple algorithm to running it on, let's say, the UK Biobank with 40,000 subjects, how do you do that? We have expertise inside the team to be able to achieve that kind of thing. And then custom deployment of you have a piece of software that is very, very specific to your needs, but you don't have a team member who can actually install, set it up, maintain that infrastructure. We're available for supporting that kind of thing. I think we move on now to open science.
Bonjour tout le monde. Entendez-vous bien? Okay, so my presentation will be bilingual. My slides basically are in French and I will speak in English. If you have any questions, please ask them in your preferred language. So the story of the Open Science team began in 2019 when we decided to build a program and we got the funding from the Neuro Tannenbaum Open Science Institute to hire staff to build capacity for open science. So compared to the other groups that have presented before, we don't have our own projects necessarily, Isabelle and myself, but we're supporting existing research projects that have an open science component to them. As mentors, we have two influential researchers here. Katie Levine is here today with us. And one of her projects is an open source neuroimaging experiment sharing platform. And we're trying to help her building that. And we get a lot of expertise from Dr. Lena Palaniapan as well, in that he's building a speech bank that is worldwide and including about 150 not countries, but researchers at the moment and forever expanding. So essentially, most of what I will be presenting today can be found on our website at the QR code displayed here. I forgot to mention our second funder, which is the Douglas Foundation, who is actively participating in the open science movement with us. And the open science is not a separate self-standing program. It's really a philosophy that's spread out across all of the other teams. And so our vision is to increase transparency and collaboration between all of us and with other stakeholders who may not be researchers and research-based. So it's broader than just the research community. We're trying to expand knowledge, and there's a whole component of knowledge translation that's part of the open science movement. So I've not presented myself and Isabelle. Isabelle could not make it today. She's on vacation. So Isabelle is an employee of the research center, whereas I'm an employee of the CIUS. And together we bridge both knowledge and expertise. So myself, I'm most expert in the policy side of data management and data sharing, whereas Isabelle is very involved with open access publication and things like that. She may have already contacted you. So feel free to contact any one of us if you have any questions. So I said that our open science journey began in 2019, but it had been existing before. There are several initiatives at the Douglas who have an open science component to them, such as Prevent AD, the Douglas Brain Bank, and several others who some of them had been existing even before we created this program. And the first thing we did when we created the program was to essentially do a consultation with a large number of stakeholders, not only researchers, but also some staff, students, and patients. And we found out what it meant to them, what open science meant to them, and what they wanted to achieve with it, and how they saw the development of such a program. And we ended up describing 5 principles for open science that were created by researchers and for the research members of our research center. So here you have the 5 principles. Today we're going to be discussing most the data-related open science practices. So the 3 first are the most relevant. So, principle one, diffuser publiquement les résultats de recherche selon les principes FAIR. FAIR is an acronym for findable, accessible, interoperable, and reusable. So it's not enough to just put your research results out there. People need to find them, understand them, be able to, and NeuroBagel can help with finding them, for example. And so people need to understand what it is that you're sharing, and specifically metadata can help with that. So yeah, in complement to the tech expertise that others have presented before, we're bringing this fairness and knowledge translation component with principle 2, faciliter l'utilisation des résultats de recherche partagés pour un impact sur l'éducation, la santé et la société. So this was to bring the idea of having new stakeholders involved as potential users for our research outputs. Principle number 3, prioriser le bien-être et la vie privée des participants de recherche et des utilisateurs de services. Of course, when we speak about open data sharing, it's mandatory that we preserve privacy of our participants. And in order to do so, we must know and respect the legal landscape, which is constantly changing in the province of Quebec at the moment. So we need to really be in contact with the ethics board and be in contact with the legal team. And this is one thing that we can provide with the open science team. Yeah, so really these principles are not, mandatory for every researcher to follow. They're more like a vision and recommendations as to if you wish to engage in open science, these are things that you might want to do. And on the website and the article that's listed below, you can see all the details of our methods and conclusions. The services that we offer is more on a consultation basis. So you might contact us for if you have projects where you wish to share open data. So more and more funders and journals expect you to share the data that was used to generate the results. So the open science team is building capacity to support you in doing that. One of the things I do as a member also this year is to build a governance structure with policies and procedures and all documents that will help guide researchers to respect the law and everything that needs to be done to protect privacy for these data. Also, we can connect you with other external stakeholders such as McGill Library and other people who specialize in data management from a policy standpoint, in complement, of course, with the other teams that have presented before. Last but not least, if you wish to share your data openly through a bank, we offer guidance navigating the complex landscape and workflow that's necessary to fill out all the forms and meet all the right people and teams that will get you there. So please feel free to contact me or Isabelle if you have any questions about data sharing, and good luck on your open science endeavor.
All right, so thank you all for all of those who presented earlier today. So as you're thinking about maybe if you have questions, I just want to conclude by saying also that what we are developing with D3SM is, of course, as we've said and try to convey, is expertise, but we want, of course, make that expertise accessible. So while we are presenting on specific projects and all, but the idea for us is to use those specific projects as a way to develop the expertise, the know-how, and then make that available for anybody at the research center. So this is clear that what we are developing is for the benefit of the whole research center.
Merci, Martin. Super interesting. I'm wondering about the virtual CBT type therapy for Inuit. Are you intending for this to be used exclusively by Inuit in the north, or what about Inuit who are accessing homelessness related services in Montreal?
Answer here. So I would say that this project was developed first by Uti Linaranta, who is another researcher who has since left. And this project has been, up and running for 3 years, and now we actually are starting to offer this therapy. And what we're doing as the first phase is really we are providing this for urban Inuit right now. So people who are physically living or at least staying for a long period in Montreal as a first phase, because providing this, I say, up north, and this is, would like to do that eventually, but there's a lot of considerations in terms of how to, let's say, deliver remotely such an intervention. So we've been working on the with a partner on the technology for that, but so that we could have a therapist, I say, physically at the Douglas, offering remotely such an intervention. But for now, we are really focusing in Montreal really to determine, to show that the feasibility and the acceptability of such an intervention. Yeah.
Martin, going back to the same question, are you also planning to develop any hardware or software, or you just wanted to use out-of-the-shelf equipment and provide solution based on those tools that are available?
Mm-hmm. You mean specifically for VR or
for VR?
For VR. So right now, I mean so we have two persons. So we have Caroline and Anna who are working on the VR suite. So what we'd like to do is first have on one side the equipment, so and make that equipment accessible. In the short or middle term, we're not planning to have the capacity to develop, let's say, environment, which takes about, although Caroline has some experience doing that, it's quite time consuming. So our strategy has been to develop partnership with company or not-for-profit organization who have already developed such an environment and make those easily accessible for researcher here at the Douglas. But the long-term plan, of course, could mean doing other more sophisticated development too. Yeah. Thank you, everybody, for attending this presentation today. And again, for all those who presented, so thank you for your time and for preparing this. Thank you. Have a great day, everyone.